Our third and final presentation for today is Jo Brown from the Southern Grampians Glenelg Primary Care Partnership, who'll be presenting on partnerships leading community resilience. We've talked a lot today about the importance of resilience, and it comes in many forms. So I really look forward to hearing your stories and examples today, Jo, in a really practical sense. Please don't forget, folks, the Q&A piece that is there. I recognise that we've run short on time a couple of times this morning or this afternoon to do that, but please do keep your questions up because there will be opportunities to answer those beyond today. So, Jo, over to you.
Thanks, Georgie. And I'd like to thank everyone for their presentations so far today. I've learnt so much already, and there's already been quite a lot that have aligned with what I'm going to talk to you about today. So, yeah, I'd like to say hello from very cold Hamilton in southwest Victoria, where I'm standing here on Gunditjmara country. I'd like to pay my respects to the elders past, present and emerging. And I've got that deliberate spring photo behind me to remind me that spring is in the air, even though it's freezing cold outside. We're getting lots of lovely rain down here, which our farming community are really looking forward to. So before I start my presentation today, I've had a little look through who's here, and there's lots of people still online at this time of the day. Congratulations to you for still being around, and which is easy because it's been so engaging. To think about my presentation, if you work in emergency management or you are someone who works in local government, have a little think about, you know, how do I get other people to work with me so that I can meet my desired outcomes? You know, how do I get people to see what I want to see and get them to come along with me in my work? And if you work in the community sector, have a think about, well, what's my role in reducing the vulnerability of the people that I work with to the impacts of climate change? And is it even my role? So today I'm going to share with you a story from our perspective at Southern Grampians Glenelg Primary Care Partnership about why we think partnering with the community in the health sector is not just valuable but actually essential, and why umbrella organisations like primary care partnerships can facilitate this type of work based on the work that we've been doing at our PCP. So I hear you ask, you know, what's a PCP? There's 28 primary care partnerships, which I'll just say PCP from now on, throughout Victoria, and we're currently funded through the Department of Health and Human Services. And we're really there to localise a partnership approach to respond to the health and wellbeing needs of our community. Our PCP has 20 partner agencies, and they consist of both our local government areas, which is Southern Grampians and Glenelg, large and small health services, Aboriginal health, bush nursing, disability and mental health, community services, neighbourhood houses, and even a water authority. And our strategic vision is to empower communities to thrive by fostering leadership, building capacity and mobilising community action. Next slide, thanks, Sandra. So why do, today I'm going to talk to you about a story from our PCP's point of view and why we think partnering is important for you today. So why do we even want to work, or why is the community and health sector and PCPs working in the climate change and community resilience space? And to me, these two quotes really sum up our motivation for working in this space. So that first quote, the impacts of climate change will be felt mostly by those who are already subject to social and economic disadvantage or marginalisation, I think really plays out even today where I am in southwest Victoria. If you think about someone living with disadvantage and struggling to pay their energy bills, you know, it's likely that they might be living in poorer quality homes. They're facing a whole range of financial stress or even other conflicting priorities that just seem more important than what the energy bill is going to say at the end of winter. Or if you are living with disadvantage, it might be about conserving energy and not necessarily using energy efficiently. So you're not heating your home, therefore you're impacting your health even more. And then the second quote I thought was a bit dramatic when I first heard it, and it's by some research in the UK that was published in The Lancet in 2009. And that was that under climate change, the wealthier parts of the population will become inconvenienced while the poor will die. We've only got to think about the heat wave in 2009 and the 374 excess deaths that we saw to really know that that rings true. Next slide, thanks, Andrew. So what we have been doing, that's a bit about the why, I guess, but you know, how do we go about doing this, particularly, you know, as a PCP or a community sector organisation? What's out there to assist us? So we started this work in about 2008, and in 2008 there really wasn't much around to guide us. There was very little research. So there's been more and more over the years that have been there to help us. But how do we get, you know, policies, research papers, other documents that can help the community and health sector particularly off the shelf and translated in a practical way for the end user? If you're a small health service or a bush nursing centre, neighbourhood house, which often just has one person coordinating, or a community group, you know, how do you navigate this information to find a way that you can help to support your local community? Next slide, thank you. So at Southern Grampians Glenelg PCP, we've been working hard over the last 12 years to build the capacity and knowledge of our partners to navigate some of that information. And we've been contributing to the knowledge base as well by some of the work that we've been doing with some pretty fabulous partners and some amazing research partners along the way. And we've learnt a lot about in this time. Next slide, thanks, Andrew. So from our work, we know that the PCP partnership platform is an efficient leadership platform in this space. We know that we can fill the gap to navigate some of that information and translate this for our partners. And we know that we can partner with research and policymakers to build that sort of knowledge base. We know that our partner agencies have established and trusted relationships with those who are most vulnerable in our community. But we also know that those same agencies have very little extra capacity to add more to their current role. We know that not all health and community service organisations recognise the valuable role they play in enhancing resilience to climate change. And I can recall doing a piece of work called Rural People Resilient Futures in about 2013-14 in collaboration with DELP, the Department of Environment and Land, Water and Planning at RMIT University. And we were talking to some of our partner agencies about who do you think is vulnerable to climate change. And, you know, we went along to one of the disability service organisations. We had our trusty climate adaptation tool with us. We knocked on the door and we went in to talk to the program director. And as it so happens that I'm pretty sure that we would not have even got a foot in the door if we didn't have that established trusted relationship with him. So, you know, got in the door, had a bit of a chat, and pretty much threw out the climate change adaptation framework, because the first thing he said to me was, "Jo, we're a disability sector organisation. We don't do climate change here." So I knew that that language just wasn't appropriate. But we were able to have a fantastic conversation in the end, because we talked about what was that agency doing to reduce the vulnerability of the people they were working with. And he talked about, you know, they had heatwave practices. People who lived in their supported accommodation were learning how to cool their home. They were learning when was the best time to go shopping. They were learning all sorts of strategies to reduce heatwave for themselves in that time. So it was about changing the language. And if there wasn't that, the PCP platform there, or that sort of trusted relationship, we wouldn't have been able to gather that information and be able to support him to develop some new strategies. So since 2008, our PCP, Southern Grampians and Glenelg, has been doing a lot of work in this space. And so we know that this PCP platform is powerful. It can play a really big role. But as I said before, there's 28 PCPs in the state of Victoria, and there's very few of them that are doing work like this throughout the state. Maybe a few more have come on board through recent events such as bushfire, but it'd be preferable not to have these big events in order to get more and more PCPs working in this space. So we went to the Lord Mayors Charitable Foundation and said, we're doing some great work, which they recognised, and they funded us to take the work that we've been doing to other PCPs across the state of Victoria. And so we partnered with the Global Obesity Centre at Deakin University, and you might think that that's a climate change community resilience in the Global Obesity Centre. I'll tell you how that works in a moment. And two other PCPs so far to elevate this work to more PCPs across the state. Next slide, thank you. So I'm going to mainly centre on the process that we use, which is group model building, which is part of community-based systems dynamics. And it's also a part of systems thinking, which thanks to Emily and Miriam's presentation earlier, if you saw that, with the foresight obesity map, you know, you'll be very familiar already with the systems thinking approach. We've been introduced to this approach through GLOBE, which is that Global Obesity Centre at Deakin University, and our work at Southern Grampians Glenelg PCP. So it's a process that we've used a few times to build some shared understanding with our community. We're really lucky also that part of our project team, one of the team members from GLOBE is a chap called Andrew Brown, who studied under Peter Hoffman, who's one of the key drivers of community-based systems dynamics. I think we've been pretty lucky to have those connections. So group model building process engages a diverse group of people who have to develop a shared understanding of a complex problem. So that they can understand all the different connections to create that visual map, like the systems map we saw earlier from the foresight obesity map. And that map we've been using to mobilise action. And we've used this very successfully in our obesity work, as well as other pieces of our place-based work. So I'm going to quickly guide you through the process that we've used with our PCP and then trialling with 2 others. And that's normally undertaken in 2 to 3 3-hour workshops. Next slide, thank you. So firstly, a group of 5 to 12 people who have really diverse experience of the topic come together, and they begin a discussion around a question that's based in their local context. So for our PCP, that question was, you know, what factors driven by climate change impact the health and well-being of our community? This isn't a brainstorming activity, but the participants really consider what they're seeing in their community, and they translate this into stories, and they consider how these factors or these stories are changing, and what they fear will happen if there's no intervention. The process in itself is you know, sort of strictly defined, this group model building process, and it allows for sort of individual reflection, small group work and large group sharing, so everybody gets a chance to participate. So what we do in group model building is we then we start the conversation, and we use some software called Sticky, which is systems thinking in community knowledge. I'll have to look that up, which is developed at Deakin with other partners. So in our first piece of work, people told these stories, and we plotted them around this circle called the connection circle. So we were able to look at, people told stories about different things like health service impacts. They talked about emerging weather events, etc. Next slide, thank you. So the next process in the group model building session is then to start looking at the connections between the different factors, and these are based on the stories and based on what people are seeing in the community. So here's the start of a connection circle. So if you go to about 3 o'clock on the circle, you'll be able to see extreme weather events. So as extreme weather events are increasing, there's more and more impacts on people. As there's more impacts on people, there's more people adapting what they're doing or adapting practice. As people are adapting their practice more and more, they start to learn from each other a little bit more. As people are learning from each other a bit more, they're having less impacts on people. That's with the dotted line, if you can see that on that little circle. And that's actually a feedback loop. So what we'd hope is that if we can intervene in that loop, we can make some change. I might go to the next slide, thanks. So then we keep going with all the stories around the group, and until we've got a pretty busy connection circle. And some of the stories that we heard from one of our first workshops were things like, you know, recreation reserves are dry, and so that has consequences for physical activity. If people can't play sport, there's consequences for their mental health and social connection. We heard stories like, you know, lack of financial security for our farming community means that people are moving off the land and away from small towns. And then as a result of that, shops and schools are closing, and even the health services closing. So people have got to go out of town for their services. Cost of living, like energy costs, as I mentioned before, is rising. So people have to decide whether they spend money on medicines, food or power bills. Due to lack of rainfall, people aren't growing their own fresh food, so there's a bit of decreasing access to fresh fruit and veggies. And we're having more heat waves or more prolonged times of heat. So that impacts can even creep up on us slowly, and sometimes people aren't as prepared. Next slide, thank you. So magically we click a button and up pops this lovely systems map. So how does this systems map even help us? Next slide, thank you. So what we've used the systems map for is to start to look at, I guess, where we can mobilise action by looking at highlighting some different themes within the systems map. So a little bit different from the stories we heard earlier, this is about looking at the factors in the map and seeing where we can actually make change, and then later looking at the whole system. But you can look at the systems map to start to look at, where there are gaps in the system, where you can highlight where there's capacity within the system, where there's willingness to work, or alignment with other work. It might be seen, to identify partnerships. So the group in this workshop started to look at the fact that the importance of community spirit, that sort of circle in the middle, that was around identifying local leaders and champions. And then that bigger circle showed how that was that could translate into action by looking at how impacts on the individuals are increasing community spirit, and local leadership could facilitate learning and adaptation. Next slide, thank you. Then we looked at this theme became apparent, this thread circle, on how we can adapt our practice. So service users, when I looked at the connection circle previous, service users were saying we're seeing impacts of increasing climatic events, and we're doing things to adapt our practice, and then we're trying to make change. The way the PCP could help here is that platform could bring people together to share their adaptation ideas or their changed practice, because the language they would be using might be changed practice, and start to work together to learn and share from each other. Thank you, next slide. So we're also doing this work, then we went to Enliven, which is our PCP in outer east of Melbourne, and we did some work with them around their local community, which was around culturally and linguistically diverse communities. And that's just a quick summary of the work that we did. And then we had a global pandemic and we had to hit pause on this work. Next slide, thank you. But for us, it wasn't so much as pause as pivot, which is the word of the moment, isn't it? Everybody's pivoting their work. Because at Southern Grampians Glenelg PCP, we had these established partnerships and networks in a number of initiatives. And in one of our networks, we collaboration for community resilience. So we started to look at what is the shared understanding of the impacts of COVID-19 on our community. And we started to document those in all sorts of different ways. And then we thought, we need to be doing this through group model building. We need to be looking at what the system looks like and creating some causal loop diagrams is what we started to do. And this work has started to inform some action that we're starting to put together in a document to inform social recovery. Next slide, thank you. So what does this all mean? Have a think about the question you asked yourself at the beginning. How do I, if I work in emergency management or in climate change adaptation, how do I bring others along on the work that I'm doing to meet those outcomes? And if I work in the community sector, how do I get people in my sector of the community to reduce the vulnerability of the people they're working with to climate change, and is it even their role? So what? So why do we even do all this work? And why do we use group model building and develop these systems maps? So firstly, it helped us to understand the complexity, and we know that complex issues are not linear. They have multiple layers and connections, and getting people together to look at the complexity and look at all the factors and the connections was really good at creating a shared understanding. People suddenly could see the big picture, I guess. There's an opportunity for identifying alignment. So where we're trying to align to different pieces of work, people can see where their piece of work or their strategy or their operational priorities fit into the bigger picture. It's easier to identify partnerships when you can look at all the connections. people can identify their place in the system. I've been to ran a number of these types of workshops where at the end of the workshop there will inevitably be somebody who taps me on the shoulder at the end and says something like, you know, oh, my manager tapped me on the shoulder to come to this workshop today, didn't really know what I was coming to. We don't do climate change, you know, I'm a district nurse, I don't do that. Now I've been to this, I understand where my place is in the system. So I think that's really important. And I think earlier the keynote presenter today, which was amazing, Alice Hill, talked about, you know, the fact that you don't need to be in formal leadership to be able to influence the system if you can see yourself in the system. And we've used this group model building approach to mobilise action because you can see so many connections, you can see where you can act. And that's been really obvious as well in our obesity work, where it doesn't matter if your action's big or small, that you're able to see where you can intervene in the system. So hopefully that's, next slide, thank you. Hopefully that's covered some of your questions, and that's my conversation with you for today. You can feel free to contact me at any point on that email, and I've really enjoyed sharing this with you today. And my timer hasn't gone off, so yes, I'm on time. Thank you, Georgie. Oh, there it goes.
Jo, incredible timing first and foremost. Thank you so much for that. But also incredibly powerful, practical example of putting that process into place. I guess, you know, we're human creatures, we learn through stories. To be able to collect those stories and then turn them into a map that makes sense, a really powerful way to engage new people. And evidently through a number of the questions, people have really honed that and been most interested in that. So obviously one of the questions is around the software, first and foremost, as a very administrative matter. So if you're able to get that to us at some point. Oh, look at you go, wonderful.
Yeah, it's systems thinking in community knowledge exchange, sticky for short.
Excellent. I'm sure we'll all be rapidly scribbling that down. One of the things that I couldn't help but really, I guess, think about in terms of the people telling their stories, if it all starts from that process, I had two thoughts about the room, I guess, from my point of view. Firstly, it can be quite often easy for people to make assumptions that an outcome is causal of a certain activity. So was there any validation done around those causal effects of events or perceptions? And I guess secondly, then it's about how do you make sure you get the right people in the room?
Yeah, so two things about that. I'll start with getting the right people in the room. I think it's about diversity, getting diversity in the room. So when we've been doing this with our climate change work, it's been not necessarily about having a representative of every cohort that we might work with, but just making sure that we have some diversity. And when we've done this type of work with obesity, with our obesity work, we get that diversity of local community leaders or people who represent different communities in the room and develop the maps, and then we take the maps out to the community to look at mobilising action. Within this climate change work, PCPs for Community Resilience, we've got people around the table from different organisations or that just have diverse experience. It's just getting that diverse experience all together that brings it together. And I think the second part of the question was validating the different, because it is not a brainstorming activity and is not people's perceptions of what they're seeing, but it is the actual what I'm seeing and experiencing in my community now. That it's not about going back and validating. If somebody's saying, I work as a district nurse and I'm seeing more people who are coming to me with smoke-related problems during bushfires. We're not going out to validate that. That is what that person is seeing in their community. So that's how it works.
Mm-hmm. Which I guess ultimately makes it really important to have all the PCPs on board or the right players on board. Were there reasons that some of the players were reluctant to be on board initially?
Yeah, it's probably not a reluctance. So of the 28 PCPs throughout the state, primary care partnerships throughout the state, not all the PCPs work in the climate change and community resilience space. So these primary care partnerships develop their priorities of work based on the needs of their community, and they're traditionally health focused. So they're traditionally, you know, like our other priorities are around obesity prevention, prevention of harm from drug and alcohol. Other PCPs might be doing work in family violence, or they might be doing work in service provision, around health service provision. So PCPs and the health sector are very traditional at looking at, you know, what is health. And I think climate change, although an emerging issue, or as an emerging issue, I guess, would be one of the reasons why people haven't seen, or other PCPs haven't seen it as their role. But I think that it's actually been mentioned in the Lancet as the most urgent health issue of our time. So more and more PCPs are coming on board. I think too, it's about their experience. A bit like us starting out 12 years ago. It's like, what's our role here? You know, how do we use the work and knowledge and the relationships that we have now to do this type of work? So ideally, we're working with these three, and we'll call them early adopting PCPs if we're thinking about change, and we're hoping that those PCPs then work with other PCPs, and the language just becomes, you know, a little bit more part of our everyday language, rather than seen as, you know, Southern Grampians Glenelg PCP, you know, doing something a bit different out there in southwest Victoria.
And I think we've probably got time for just one more question. In terms of the items, there's a question here. You know, the power of the project is really around people having had the opportunity to be heard. How do you follow up and measure the change that results from this approach, or I guess conclude or continue, I should say, that feedback loop that you talked about sort of partway through your presentation?
Yeah, we're still in the process of that, and because for the climate change work, so if I'm talking about the PCPs for community resilience in our climate change work, the measurement will be on, so when we've identified themes that we're going to look at, we'll construct some measures. So for example, our PCP's theme was around looking at how's the platform of the PCP bring our partners together to learn from each other. So we'll measure what they've learned. In our obesity work, the measures are actually around weights of measures of young people in school. So they're very much the outcome measures at the end, and the processes like, you know, how do we go about that, you know, how many actions are happening in the community, who's involved. Some of that can be more process driven, but certainly it's more about outcome measures.
Perfect. Thank you so much for that. And thank you for a wealth of information that's been shared this afternoon. So I really appreciate that. I think we've managed to answer most of the questions there, but if there are any others, we will, of course, share those on the Knowledge Hub as well. Thank you, Jo, for your time. That does bring day one of the Australian Disaster Resilience Conference to a close. So thank you for joining us for day one of Knowledge Week. On behalf of the conference team, thank you for joining us. Join us tomorrow from 2 p.m. Eastern Standard Time for day two as we explore the theme local leadership. So your host tomorrow will be Michael Aman from the Local Government Association of South Australia, and obviously a fellow member of the Conference Program Committee. Tomorrow is also going to feature the Australian Disaster Resilience Network virtual afternoon tea, which starts at 3:30. So that is a chance for you to hear more about the network, as well as meet each other and have some guided conversations with other conference delegates. So don't forget the flashcards for those of you who are here when Amanda was doing her presentation piece. The flashcards are a great opportunity to share and exchange some of that information and allow you to network with members in Zoom breakout rooms. It is a free event. So if you've registered for the full conference, you should have a Zoom link in your inbox. And if you're interested, make sure you fill in the flashcards, as we've said already, you should have that link. If you don't, then have a look in the chat piece from today, and that should be there. And I can see the link for the network flashcard, so that you don't have to scroll all the way back up. I can see that it's there at the bottom now, so you can do that now as you finish up for the day. Thank you once again for joining us today. There's been some amazing presentations and it's been my absolute pleasure to host this afternoon. So thank you. We'll see you tomorrow. Farewell and stay safe.